All right, so this is the lecture recording for lecture 1, Introduction to Anatomy. Okay, so the anatomy, when we study anatomy, we're looking at the structure. And physiology has to do with the function of those structures. Many of you will be taking physiology after this class, and physiology, will require a strong foundation or a strong understanding of what those structures you're studying are called. And as you'll soon see, it's really hard to separate the two. So these are closely related. So that means oftentimes in this class, we'll be looking at some functions as well, okay? So it's very important when we study anatomy, you try to, you consider the way something is designed as it relates to its function. So how does its design help it serve its function? And that will be a concept that we'll re-emphasize in these next series of classes. The study of anatomy can be divided into two general disciplines. The gross anatomy is study of anatomy that can be visualized through the naked eye. Microanatomy or microscopic anatomy is done through the use of microscope. Okay. So here's an image of life micrograph showing you a tissue, which hopefully you'll be able to identify at the end of our next lab. Anatomical terminologies are oftentimes based on ancient Greek or Latin. I'll post a handout I can use to make references for many of these Latin roots, word roots. Now, the study of anatomy can be done through a hierarchy of structural organization, starting with the chemical level where atoms and molecules make cells. And cells of similar types then come together, along with their associated extracellular material, come together to form tissues. Tissue is going to be the main topic of our next lecture. Okay. And as you'll see, tissues of different types come together to form distinct organs. Okay. And organs are the things that oftentimes were most easily named, like the liver, the heart, etc. Okay, so organs can come together and form organ systems. These organ systems are made up of organs that serve a specific function. An example of that is the cardiovascular system, which comprises of the blood vessels, the blood that's contained within, as well as the heart. In this system, the heart generates pressure that pumps the blood and drives them through the blood vessels. Okay, and so together they serve the goal of supplying your tissues with oxygenated blood. Now, these different organ systems, which we'll discuss in the next few slides, will come together to make sure that you as an organism is functioning properly. Now, if you need to pause anytime during this lecture, this video, and come back later, when you're done reading all those texts, please feel free to do so. So go over this on your own. The nervous system, I do want to mention, relative to the endocrine system, the nervous system is the fast-acting control system. The signal that's transmitted through nervous system is the electrical signal. So think about electricity is traveling through wires. It's a very rapid action. Contrary to that, the endocrine system is a slow acting system, because it relies on the hormone that's secreted by those glands to diffuse out of the tissue, travel through blood, and then flow through the blood and get to the destination before they can act. Okay, so it's a slower acting system. So if you need to pause here, please do so. I didn't include these images in your lecture note because they just seem like they're going to be really wasteful in terms of ink. So much black ink. This slide, okay, you'll see much of this information is being left out of your lecture note. Okay, really the only two that we'll be discussing in lab are micrometer and millimeter. So you should be able to convert between the two. 1 millimeter equals 1,000 micrometer. So I can ask you how many micrometers in 2 millimeter or 2.2 millimeter. Well, 2.2 millimeter equals 2200 micrometer. You should understand that meter is a measurement of length. It's a metric measurement of length. So in science, we use metric measurements instead of imperial. Imperial measurements would be inches, feet, pound, okay, etc. But really, the rest of the world is sticking to metric. It's because metric deals with multiples of 10. It's actually easier to study. Now, grams, whether it's kilogram, microgram, they're all measurements of mass, whereas liters measure volume. These are examples of what can be measured using each of those. Moving on, the anatomical position. This is the anatomical position. Hold on, just let me close off the fan. In the study of anatomy, it's important that we have a common reference point. And so this is why we have the anatomical position. When someone says anatomical position, you should know what it looks like. Right? Stop it. So in someone's anatomical position, your feet are closely together or together. Your toes are pointing forward. Your palms are facing forward. So not like this, right? So like this. Okay, not like this, not like this. Sorry, like this. Okay. And you're standing up straight. Right? Your neck is straight. Your neck is not flexed. Okay. Your thumbs are pointing to the side, away from your body. So this descriptions of location are going to be based on this anatomical position, as you'll see later. Regional terms are absolute terms that are used to describe specific locations on the body. And regional terms can be roughly divided into two groups. Okay, the axial region, those that describe the axial region. Axial is along the axis, right? Imagine there's an axis down the center of your body. So this is the axial region, and then appendicular region are the things that are seen to be attached to it. Okay, so they're the upper limbs and lower limbs. Each of those can be further divided into smaller regions. Directional terms are relative terms that are used to describe the location of one structure relative to another. Now let's talk about regional terminology. The axial region is comprised of the head, neck, and the trunk. And then the trunk can be further divided into these smaller regions. As you'll see later in this course, many structures in each region are going to be named accordingly. So there's the rectus abdominis muscle here, okay, and then you have cervical lymph nodes in your neck. Okay. And then you have a pubic symphysis, which is a joint here. Okay, so those names are interrelated. I want to emphasize again that anatomy often has students struggle because it seems like an entirely foreign language. Right? It's going to be challenging, not really because I'm a hard instructor, really because this topic is challenging. So it's important that you try to make sense of what you study so that there's less memorization to do. Right? After all, there's still going to be memorization, but hopefully you can minimize that. Okay. Appendicular region are the upper limbs and lower limbs. Upper limbs, also known as upper appendages or upper extremity, similarly with lower limbs. It's important to know that in anatomy, upper limb is not synonymous with arm. When we say arm in anatomy, we're really meaning the brachial region, which is the region between your elbow and your shoulder. It does not refer to the forearm or antebrachium. Upper limb is the whole thing, okay? But arm is only this region. Leg is only this region between your knee and your ankle. Okay, so lower limb is not synonymous with leg. Okay. Okay. There's a list or a table of these regional terms on page 3 of your lecture note. To go over that, make sure you understand each of those. Okay, and practice with your spouse, practice with your kids, maybe not your dog because your anatomy is a little different. Now, directional terminology. Directional terminology. These are terms that are used to describe where a structure is relative to another. Superior is in that direction. Inferior is opposite of that, lower, right? Medial, so for medial and lateral, you have to imagine a midline down the center of your body. Okay? And closer to that midline, that's going to be medial. Away from that midline is going to be lateral. I'm going to try to share. So down the center of the midline, this is medial. You say your nose is medial to your cheek. Okay? Your nose is medial to your ears. Your ears are lateral to your nose. Your nose is closer to the midline of your body. Now, when we're talking about where something, how far away something is relative to another in terms of how, sorry, let me rephrase that. The term proximal and distal are terms that are only used when we're referring to structures on the upper limbs or lower limbs. Okay. And so you can say your hands are distal to your forearm. Okay, so distal meaning that it's farther away from that point of attachment, okay, to the trunk. Right? So your fingers are distal to your palm. Your palm is proximal, which means closer to the point of attachment relative to your fingers. Your hand is distal to your arm. Your arm is proximal to your forearm. Okay. A common mistake students make is they'll say, oh, I'm sorry. They'll say that your knee is superior to your leg, and that's wrong because what this is, right, when we're talking about limbs, we have to use the terms proximal and distal. So how the correct way of saying that would be your knee is proximal to your leg. Your leg is distal to your knee. Okay. Similarly, your thigh will be proximal to your knee. Okay. And your knee will be distal to your thigh. Okay. So when we're talking about structures on your upper limbs and lower limbs, make sure to use proximal and distal. Okay. But when we're talking about structures in this axial region of your body, you can do superior and inferior. Ipsilateral means it's on the same side. Contralateral means it's on the opposite side. How can I show you this? Just a second. Give me a second, just putting on some makeup. Gotta look good for the lecture. Ah, see a second what I'm trying to do. All right, this is what shelter in place does to you. Right now, my black eye is ipsilateral to my mole. Okay, so this is ipsilateral. Now, I got a scar on this side. This scar is contralateral to my mole here. You can also say it's contralateral to my black eye, okay? Okay, so that's contralateral and ipsilateral. Unilateral means it's only on one side, okay? My scar is unilateral because it's only on this side, right? But if I get a scar here, now I have bilateral scars, okay? You can say someone has bilateral pain or bilateral, something bilaterally means it's present on both sides, okay? And oftentimes in medicine, we'll say someone's range of motion or someone's, the functioning of their parts of their body is examined through physical exam. Shows that they're functioning normally on both sides of their body, okay? It's easier way of saying, oh, this person's right arm is working and then this person's left arm is working, right? Just say, oh, both arms are working bilaterally. It's easier. All right, maybe I should take a second to wipe off this stuff on my face. But let me first explain. Anterior and posterior. Anterior, okay, is to work the front of your body, and this is posterior, okay? When we're talking about human anatomy, which is the only thing we care about in this class, right? Instead of a four-legged animal, anterior and ventral can be used interchangeably, such as the case you're gonna see later in this class. Oftentimes we'll use those terms interchangeably. So this side can be described as anterior or ventral. This side could be dorsal or posterior. Okay. You could say your cheek is anterior your ears. Okay, your lip, your upper lip is anterior to your teeth. Okay, but that you could also use deep versus superficial for that. Okay. Now you can see your chest bone is anterior to the heart. Okay. But you can also say deep versus superficial. Okay, so deep is away from the body surface. Superficial is toward the surface, closer to the surface. So if you have a needle, you poke someone with a needle, right? It's gonna reach that superficial layer first before it reaches the deeper layer. Okay. Body planes and sections. Where's my clipboard? Okay. So when we look at our body in 3D, you can divide a body or cut a body into sections, okay, along a flat surface called a plane. And so the frontal plane is also known as the coronal plane. This is the frontal plane, okay? It cuts your body into anterior and posterior halves, right? This is anterior, this is posterior. It cuts your body into anterior part and a posterior part, okay? But this is also a frontal plane or coronal plane. This is a coronal plane, frontal plane. This is another frontal plane. Okay, so you can cut it at different levels, but all the planes will run in this direction. All of it will cut your body into an anterior portion and a posterior portion. The sagittal plane divides your body into right and left parts, okay? If it divides your body right down the center into equal halves, this is mid-sagittal plane, or also known as median plane, okay? So this is the mid-sagittal plane. It's a very specific type of sagittal plane. This is another sagittal plane, but if it's away from, if it's not right down the center, right, it can be called a sagittal plane, but it's also called a parasagittal plane. Parasagittal planes are off the midline. Okay, mid-sagittal is right down the midline. This is parasagittal, parasagittal, parasagittal plane, parasagittal plane, parasagittal plane, parasagittal plane. Okay, this is mid-sagittal, mid-sagittal. Now we have the okay. Seems like Zoom decided to log me out again. So this is, I should be the most unfortunate day in terms of class recording that I've ever had. Anyway, well, my dog seemed to be in good spirits, so thank you for being patient. Let's move on to talking about body cavities and membranes. Okay. Okay, so you can go over this part on your own. So if you need to pause this recording and return later, please feel free to do so. Okay. But the first thing I do want to point out and clarify, thoracic cavity, which contains or houses the heart and the lungs. Okay. So that's this whole region. Okay. That thoracic region can be further divided into pleural cavities. Each pleural cavity contains a lung, so these are your pleural cavities. Pleura, as we'll see later, is the membrane that wraps around the lung. This space sandwiched between your pleural cavities, this is known as the mediastinum. So mediastinum is the space that contains the heart, but also many other structures like their esophagus, their trachea, the thymus, many other structures, okay, aside from the heart. But there's additional layering that surrounds the heart. That layering creates a space inside, okay, for the heart. Okay, and so that space created by those layers directly surrounding the heart, that's called the pericardial space. Because students oftentimes will confuse mediastinum with pericardial space. Mediastinum includes the pericardial space, but also this region above it. Okay, so mediastinum is this whole region between your two lungs. Okay, and now if you need to pause again and return later, feel free to do so. The serous cavities are these potential spaces lined by these watery membrane or serosa. Okay, and there are these layers are wrapping around the heart called the pericardium. And there are also serosa surrounding the lungs called the pleura. The ones surrounding your abdominal organs are called peritoneum. In each of these cases, there are two layers to that serous membrane. Okay, so there's a parietal pleura, there's a visceral pleura. For the heart, there's a parietal pericardium, there's also a visceral pericardium. And then for the peritoneum, there's a visceral peritoneum, and then there's the parietal peritoneum. In all three cases, the parietal layer is the more external layer. It's the layer that adheres to the abdominal cavity or the thoracic cage, in the inner surface of the thoracic cage. Okay. So it's going to be the more external lying one. The deeper one, the more internal lying one, that covers that internal organ directly, those are the visceral layers, whether it's visceral pericardium, visceral pleura, or the visceral peritoneum. Okay, so the relationship between the two can be understood in this example, or in this demonstration, where you fill a balloon with water and you try to stick your fist into it, right? I mean, it's kind of amazing that it didn't pop, but so in this example, what they're trying to illustrate that is that part of the balloon that adheres to your fist is analogous to the visceral serosa, the visceral layer of those membranes. And the parietal layer is going to be this part of the balloon that's not in contact with your fist, right? Because you can see the visceral layer sits right on top of that organ, the internal organ. Okay, but you can also see that the visceral layer and parietal layer are really continuous with one another. They're really just one, but folded in two. Okay, so they're continuous with the space between them that's filled with a thin layer of fluid, and that fluid is going to serve the function of reducing friction, so that when your heart pumps or when you're breathing in and out of your lungs, right, those two layers are going to rub against one another. You want to reduce the friction as much as possible, and that fluid is there to help lubricate. Now, abdominal quadrant, your abdominal space can be divided into 4 quadrants or night regions. You don't have to know these 4 regions that's been grayed out. Okay, but these terms are useful because when you read medical notes, it will say something like 39-year-old man with history of cardiac disease comes in with the right upper quadrant pain. Okay, and so right upper quadrant, RUQ, stands for right upper quadrant. Okay. That gives the doctor or a nurse a certain differential that's different than someone who comes in with left lower quadrant pain. Right, someone who has left lower quadrant pain, who knows they may have colitis, they have a colon issue, right? They could have a colon cancer, right? But someone who has someone who has liver disease or gallbladder disease are less likely to present with left lower quadrant pain, right? Someone who has a gallstone, if you've ever had a gallstone, you know you're going to have pain in the right upper quadrant of your body. So it tells, clinically, it's telling of a certain list of differential. It gives you this list of possibilities of what the cause might be. Okay, actually, that concludes our lecture for today. Thank you for your patience. Let me know if you have questions.